Welcome back to FabAnthonyHealthTips, the place where your body speaks and we help you decode the signs. Now, take a moment and stick your tongue out in front of a mirror. Go ahead, I'll wait. What do you see? A healthy pink surface? A white coating? Maybe even some cracks, redness, or bumps? Well, what if I told you that your tongue is more than just a muscle that helps you eat and speak? It's actually one of the most powerful indicators of your internal health, from your digestive system to your hydration level, from vitamin deficiencies to chronic illness. Your tongue tells a story. Today, we're diving deep into what your tongue might be trying to tell you, and how spotting early signs can help you prevent bigger health problems before they start. This might be the most important thing you've never paid attention to until now. Let's start with the basics. A healthy tongue should be pink, slightly moist, with a light white coating, and no cracks, swelling, or unusual bumps. But if your tongue looks drastically different, discolored, dry, puffy, or has strange textures, your body may be crying out for attention. One of the most common signs is a white-coated tongue. While it may just be leftover food or dehydration, it can also point to oral thrush, a yeast infection caused by candida overgrowth. This can happen when the immune system is weakened, or when antibiotics disrupt gut bacteria. It may also be linked to poor oral hygiene, smoking, or even undiagnosed diabetes. So if your tongue looks white and fuzzy regularly, it's not something to ignore. What about a bright red tongue? Often called a strawberry tongue, it could indicate inflammation, fever, or vitamin B deficiencies, especially B12 and folate. These are key nutrients your body needs for energy and brain function. A red tongue may also suggest Kawasaki disease in children, or scarlet fever, though that's less common in adults. Now let's talk about cracks or fissures. A few light lines might be normal, but deep cracks, especially if accompanied by burning or sensitivity, could signal dehydration, Sjogren's syndrome, an autoimmune condition, or nutritional deficiencies. It might also show up in people with geographic tongue, a harmless but strange condition where patches move around the tongue's surface, sometimes causing discomfort. Another big clue is a yellow tongue. This might look alarming, but it's usually tied to poor oral hygiene or dry mouth. Sometimes it can come from a high-fat diet or too much dairy. But it could also suggest liver or gallbladder imbalance, especially if paired with a bitter taste or digestive issues. And here's something surprising: your tongue shape can speak volumes. If your tongue looks swollen with teeth marks along the sides, it's called scalloping. This is often linked to fluid retention, poor lymphatic drainage, or low thyroid function. It may also show up in people with sleep apnea or those who grind their teeth at night. If your tongue constantly feels large or like it's crowding your mouth, it might be time to check your thyroid levels. Then there's the pale tongue, a tongue that looks unusually light in color. This can be a red flag for anemia or poor circulation. If you often feel cold, tired, or dizzy, and your tongue is pale, you may want to get your iron and B12 levels checked. Let's not forget black or hairy tongue. Yes, it's real. It looks scary, but it's usually harmless. It happens when dead skin cells build up and get stained by things like coffee, tea, tobacco, or mouthwashes with oxidizing agents. Though not dangerous, it's a big sign that your oral hygiene needs a reset. And finally, if you notice persistent sores, lumps, or ulcers that don't go away in 2 weeks, that's a signal to see a doctor. These could be signs of infections, immune responses, or in rare cases, oral cancers. Especially if it's paired with difficulty swallowing or unexplained bleeding. So what can you do to improve tongue and overall health? Start with hydration. Dehydration is one of the top causes of a coated or dry tongue. Aim to drink plenty of clean water throughout the day. Next, improve your oral hygiene. Brush your tongue gently with a soft toothbrush or a tongue scraper every morning and night. Use natural mouthwashes with ingredients like tea tree oil or aloe vera if you're sensitive to alcohol-based ones. Then focus on your diet. Add probiotic-rich foods like yogurt, kefir, and fermented veggies to help balance your gut, because oral health and gut health are closely linked. Make sure you're getting enough iron, B vitamins, and zinc. Leafy greens, nuts, seeds, and lean proteins can help. Reduce processed sugar and limit refined carbs, they feed bad bacteria and yeast. Also, keep an eye on habits like smoking, drinking too much alcohol, or overusing antibiotics and mouthwashes. These all disrupt your mouth's natural balance and can lead to discoloration or irritation. And if you wear dentures or mouth guards, clean them daily to prevent bacterial buildup. Some natural remedies also help. Swishing coconut oil in your mouth, a practice called oil pulling, can reduce harmful bacteria. Drinking herbal teas like chamomile or ginger can soothe inflammation. And aloe vera juice, in small doses, can help heal ulcers and reduce irritation. Remember, your tongue is part of your digestive system, the beginning, in fact. So what shows up there often reflects what's happening in your gut, liver, blood, or immune system. Tuning into your tongue could help you catch problems before they become serious. The next time you look in the mirror and stick out your tongue, don't just brush it off, observe. What you see might be the clue you've been missing. Because every part of your body tells a story, you just have to learn how to read it. If you found this helpful, hit the like button and subscribe to FabAnthony Health Tips for more weekly deep dives into your health. Leave a comment below. Have you ever noticed strange signs on your tongue? What did it mean for your health? Let's learn from each other. Thanks for watching, and until next time, keep listening to your body. It's wiser than you think.